So hello and welcome to the first webinar in the four-part COVID-19 and the Perinatal Population series hosted by the Colorado Perinatal Care Quality Collaborative. My name is Elena Sayers and I am the project manager at CPCQC. We've been anxiously awaiting today to begin this series and share key information about COVID-19 during this transitional time in a person's life. Prior to the presentation today, if you complete this brief pre-survey that I'm going to share on the screen in a moment, we'd be very grateful. Let me pull this up for y'all. Hold on. Hopefully you can all see that now. Colorado currently has minimal data on how organizations are handling the COVID-19 pandemic. We would love to hear from you and your experience on how the pandemic has impacted your organization. This pre-survey should take approximately 2 minutes or less. Can people see the poll? Great.
And of note, continue scrolling down if you don't see all the questions at first. There are a number of questions, so you want to make sure you're scrolling down on the pre-survey.
Great. Thank you, Jamie. Great, thank you all for participating. We really appreciate it. Just going to keep it open for a few minutes longer. While the last people are entering in this survey, we are also happy to be offering nursing continuing education credits for this event, thanks to Amy Dempsey and Cindy Krenning at SCL Lutheran Medical Center. At the end of this presentation, we will share a link to obtain those credits for this event. Okay, I'm going to close this poll in 1 second. If you have just joined, if you could please just take a moment to fill out this pre-survey, that would be great. Great. Katie, if you could go to the next slide, that would be great. So today we will be hearing from Kate Kripke. Kate is a licensed clinical social worker with a certification in perinatal mental health. Kate founded the Postpartum Wellness Center in Boulder and continues to work at the organization as a senior supervising psychotherapist. Kate began her career working in South Africa as a health and wellness community advocate. Following her time in South Africa, Kate worked in New York City as a teacher and guidance counselor before pursuing her master's degree in social work. Overall, Kate has over 20 years of experience helping individuals in times of transition. We are excited to hear her perspective on the impact of the COVID-19 pandemic on maternal mental health. Please help me welcome Kate Kripke. And Kate, I'm going to have you share your screen so that you can drive.
Awesome. All right. Technology is not always at the forefront of my skills, so hang on 2 seconds. I think I got this set up. Give me just a sec. Okay.
If you go to the top right-hand corner, it says slideshow, and that should be able to a little down. Yeah, right there.
Awesome.
Perfect. Thank you, Kate.
Yeah, no problem. I am, gosh, I'm just so happy to be here, and I really appreciate any opportunity to talk about early maternal mental health. I'm especially interested during this time of this pandemic when we know that so many new families are really struggling already in the shifting to new parenthood. And so having this opportunity to talk about the impacts of COVID is really exciting to me. I think that many of you probably already have a lot of this information. And so I want to be really clear that oftentimes you might find that what we're talking about here is really just reinstating what you already know, and perhaps even helping you validate what you know already so that you understand why what you're doing is so important. And really, it does take a community to provide the biopsychosocial support to pregnant and postpartum people. And so I'm really excited to dive in today. Okay, so we're gonna focus on 4 different objectives today. We're gonna talk about what's normal, what we consider to be normal postpartum challenges, and how those differ from more clinical mood and anxiety disorders. We're gonna identify vulnerabilities in pregnancy and postpartum that really have struggles for moms increase and pregnant families increase during COVID-19. Also identify the protective factors. We do know that there have been some families that have been really well protected during this pandemic, so we want to talk about those. And we're going to talk about prevention and supportive measures such as screening and assessment. I'm going to do today just a little bit differently. I think in the past, or often we have saved questions till the end of our talk, and I'd really like to encourage folks to type in the chat questions you have as we go along. I do find that helps us all stay engaged, and I really want to make sure I'm addressing each of your questions and concerns and ideas as we move through this talk. So I think one of our facilitators is going to help with that as we move through these different sections. All right, so in general, we want to start with some basics. And again, I'm assuming that many of you know this already. Perinatal mood and anxiety disorders, that, by the way, really encompasses this period of time from pregnancy through that first year postpartum. That's what we consider perinatal mood and anxiety disorders. And we used to talk mostly about depression, but what we know is that anxiety is one of the leading symptoms that we see in these issues. So we really want to be thinking beyond just that scope of depression symptoms and into anxiety and other mental health challenges as well. Really, the most common obstetric complication for pregnant people and birthing people, and also the most underdiagnosed. So super important to know that about 75% of birthing people will not be diagnosed with a depression or anxiety that they struggle with after having a baby, and 78% of those positively screened are not connected to services. So at the end of this talk today, I am going to talk a bit about what it looks like to sort of assess and refer as appropriate, so we get more families with the support that they need. About 1 in 5 perinatal people will be diagnosed with depression or anxiety or a combination or something else. And we really also important to note that these are the people who are raising their hands. Right. So we believe in the field of perinatal mental health that probably these numbers are much higher than that. Those perinatal people, pregnant and postpartum, who are not well enough supported biologically, psychologically, and socially, will develop symptoms of depression or anxiety. We often used to talk about this as may develop, or we wait till these folks are struggling and then we provide services. But we really know through data and ongoing exploration that if folks are not well enough supported in these three areas, it's pretty inevitable that they're going to develop some symptoms of depression or anxiety in that perinatal period. These symptoms can easily be confused with normal adjustment. And so we want to be looking at the severity of that pregnant or postpartum person's symptoms, the frequency, how often those symptoms are showing up, and the duration of their stress. And that is really those are sort of diagnostic criteria that I think many of you may or may not be seeing your clients and patients long enough to be assessing for that, but that is something that we look for. Unfortunately, untreated and undertreated PMADS can actually cause quite significant health issues for babies and children. So what we want is for those families who are struggling to get support really, really quickly. Anxiety is certainly the most common symptom of postpartum depression. And I know that can feel odd when we use that word depression, but I can't tell you how often women who are pregnant and postpartum people will come into our office and say, I'm not depressed. I'm feeling anxious and not depressed, so I can't possibly have postpartum depression. And we want to make sure that folks understand that there's a whole gamut of symptoms that someone will struggle with. Presentation of these disorders can it can present in all different ways. So again, oftentimes clinicians or the parents themselves can look for things like depression and low mood and crying, but often these symptoms will show up more like rage or guilt or hypervigilance and insomnia. So we really want to have an open mind about what these disorders in mood can look like during pregnancy and postpartum. And of course, we want to pay really close attention to health disparities, because even if you take away sort of the general, hormone shifts and external stress and internal stress that can happen both during a pandemic and not, there are certainly health disparities that have to go. We have to pay attention to those and really understand that those folks who are struggling with racism or other oppression are going to be more at risk for these mood disorders. And as if having a baby wasn't hard enough, right? When a person goes from pregnancy through birth to postpartum, there is all kinds of struggles and challenges, both emotional, psychological, logistical, social. And when you add the stress and anxiety of a pandemic, and you add the stress and anxiety of all of the protocols that have come forward during this pandemic, you're adding a big layer of external stress. What we believe in general is that postpartum mood and anxiety disorders are caused by the balance or the interplay between brain resilience, which gets impacted by giving birth and the way those hormones impact brain chemistry, and external stress, right? The interplay between those two things is what causes space for depression and anxiety. So as our resilience decreases because of hormone shifts or lack of sleep or nutrient depletion or dehydration or recovery from childbirth, and our external stresses increase, right? We have them already, right? Learning who we are as a parent, negotiating relationship challenges, parenting other kids at home. Adding a pandemic increases that gap so significantly that what we're seeing is actually higher numbers of postpartum parents who are struggling with depression and anxiety in general, and then increased severity for those parents who might be struggling already. So really impacting something that is already challenging. So let's dive in first to some of the more obvious things here, right? I think everybody on this call today understands that you probably feel it for yourself as well, but that this pandemic, this virus has created this just distinct increase in things to worry about, right? So our new parents are feeling high increases in fear, worry, and sense of being out of control. Those are things that most new parents will feel anyway, right? I have yet to meet a new parent who doesn't feel moments of fear or worry or a sense of being out of control. But when you add this pandemic, when you add COVID, those feelings increase dramatically. There is, of course, more social isolation and loneliness, and fewer social interactions. That, of course, is changing a little bit as things open up as we move through this pandemic. But new parenthood is isolating as it is. And so when you add the social isolation that's come with this pandemic, again, those feelings are just deeply increased. We have a decreased access to supportive resources. So things I think about here are like mom, parent, baby groups, right? We have access to all kinds of social containers for new parents that have really been put on the in-person resources like that have been put on the back burner because of this pandemic. And we do know that while we'll talk about this in a moment, they've been more access to online and virtual support, there is something that is lost in that person-to-person, face-to-face interaction, and our families don't have access to that as much as as before. And shortened hospital stays. So we saw this especially in the beginning, and some of you who are working in hospital settings are probably privy to this in a big way, right? More parents were leaving hospitals quicker so that they could have access to the support that they wanted when that support outside support wasn't necessarily allowed into hospital settings. So we have shortened hospital stays, that reduced early support that families might get while they're in their hospital. And that can, of course, cause more of that anxiety that happens for new parents. We have seen an incredible increase in strain in primary relationships during this pandemic. The rates of referrals for couples therapy are off the roof, right? Many of us in this talk will probably know. I don't know anybody who hasn't felt more strain during this pandemic at home. And that, of course, can be a stressor for a new parent as well. Huge financial impacts. And of course, when we have new parents who are constantly hearing news about the traumas and tragedies that are coming along with this pandemic, that traumatic content can cause great distress for new parents. There are some protective factors, and this is really interesting. I don't know if any of you have felt this yourself or seen this in your families or patients or clients, but having the protection required, the isolation required for new families right now has actually eased some stress and strain for new parents. Oops.
Hey, Kate, there's a question that just came up.
Great, please, great.
Yeah, it says, what % of perinatal people are diagnosed with PMADS who have not previously been diagnosed with mood disorders? Or in general, how common?
Great question. Thank you for asking. So about 1 in 5 perinatal people will be diagnosed with an anxiety or depression or anxiety or other mood disorder in that first year postpartum. So that's a really high number, but I want to remind folks that we're only counting the people that raise their hands. So we still believe that there are lots of folks who are struggling and not talking about it. People who have a prior history of depression or anxiety are twice as likely to develop a PMAD as someone who doesn't, right? So you have 1 in 5 for your general population, and then you have a twice as likely factor for folks who have a prior history of depression or anxiety, including those folks who struggle with depression or anxiety during pregnancy. Hope that answers that question. Happy to add any more clarity if you need it. And any other questions at this point?
No other questions at this point. Thank you, Kate.
Okay, great. Okay, so we know that some of what has happened for folks during this pandemic has been protective, especially for people who are really needing and wanting, and I might include every postpartum person into this category, who might be needing and wanting support and care at home. So, this actually can go 2 different ways. It can go in the way of protection for parents who are partnered and have co-parents at home. And of course, it can go in the other direction for parents who are single parents and don't necessarily have access to extended family or other support in the home. But for people who are partnered, that opportunity to slow down, that opportunity to have a co-parent around versus a co-parent who goes back to work fairly quickly, that extra attention to keeping the house clean and keeping your baby protected from germs, certainly fewer expectations around socialization outside of the home as well as inside of the home. This has actually been quite protective for many partnered families' mental health, because the slowing down, the cozying up, the co-parenting inherent in that picture has been really useful. Again, I do want to note that for those single moms, this is not necessarily the case, because that isolation can cause more distress. But we have found that the kind of already put into practice expectations around not having to go out and be busy and see other people and having that sort of coziness of the family at home has been quite protective for some families. There has been a boom in virtual support, as we all know. So in the field of mental health, some of us were beginning to offer telehealth support before this pandemic started. And then of course, just like overnight, we created opportunities for families to receive support from their homes. And we have found here at the Postpartum Wellness Center that the increase in access to care has been phenomenal. And we've really been able to tap into that early perinatal mental health support that families need, because those families have not needed to get to an office to receive that support. All kinds of online communities, and there is just this sort of in your home validation of emotional distress. And I think one thing we found prior to the pandemic is that lots of families were struggling and suffering in silence at home, not knowing that they were part of a larger army of people. And so access to this virtual support has really increased the capacity for validation, having families feel seen, and again, having access to that support, lots of free support, certainly paid support as well, but access to support for those new families right in their homes. One of the things that we have noticed, which is really interesting, is that because so many of most of the general population has felt an increase in fear and anxiety during the last few years of this pandemic, that folks whose fear and anxiety is actually symptomatic and warrant of clinical support, those folks have in some situations gone under the radar. So some of these sneaky symptoms look more normal during COVID, right? So many of us have an extreme health anxiety right now, or have over the last 2+ years, right? Many of us are thinking more about our health and wellness and being afraid of illness and death for ourselves and those people that we love than we did before this pandemic. That is also a symptom of pretty clinical anxiety for new parents. OCD, obsessive compulsive disorders, are on a rise right now, right? So we have been taught and told to wash our hands, to wipe down, especially in the beginning of this pandemic, to wipe down groceries, to change our clothes when we come home. That was a big part of, when we think back to how this pandemic has shifted and how we've responded to the pandemic over time. In the beginning months of this pandemic, many of the behaviors that were normal were behaviors that some of our very anxious clients and families and parents with OCD would be exhibiting even if there wasn't a pandemic. So all of a sudden, these symptoms were normalized. Lots of phobias, lots of feelings of panic, lots of social anxiety. Social anxiety is a very common symptom of postpartum anxiety for many new parents. And of course, many of us were feeling that, right? It was normal to not want to go out and be in public places and be in groups, being with groups of people. And then these depressive symptoms that we've really tapped on some of these already, that social isolation, anhedonia, sadness, hopelessness, fatigue, agitation, all of that was normalized. I'm not sure I experienced anybody in my personal, professional life who wasn't feeling these things, especially in the beginning. So again, what happened here is that lots of our parents, lots of our families who were actually struggling with very severe symptoms of depression and anxiety weren't being noticed, and they were feeling normal because they were part of a community in some of these symptoms that many of us were feeling perhaps for the first time. So yeah, again, I think it's just worth noting many of us who weren't feeling these types of anxiety or symptoms prior to this pandemic were suddenly feeling them, and that was normal, right? It was a normal response to stress and trauma. And then you had those folks who were at risk for a postpartum anxiety or mood disorder or depression, and they were feeling these symptoms to a higher degree, and were often getting lost in what we were seeing as normal. Oops. So let me pause for a moment, and Elena, if you would just see if anybody has any questions. I'm just curious to make sure I'm not missing anything for folks about any of this, about how COVID and this pandemic was impacting those families who might already be at risk for depression or anxiety, how this pandemic might mask symptoms, as we're talking about right now, or how they might actually be protective. And of course, I'm happy to pause here and see if anyone has any basic questions in the difference between normal postpartum adjustment versus postpartum clinical depression and anxiety. And if not, we can come back to those questions later.
Yeah, I don't see any currently, but if anyone quickly has a question, you can type it in, or I can unmute you. I mean, you can ask that to Kate. So I'll let you pause for a few seconds just to ponder what Kate just asked. If you have any questions, feel free to add that in the chat or in the question and answer box. Or again, I can take you off mute.
Yeah, or comments as well. I think it's always
Yeah.
useful I'm not entirely sure how many people are here because I can't see anyone's face except for yours, Elena. So it's, when we do these talks and speak to a screen, it's hard for me to read all of you. So I know that many of you are probably seeing new families, and I'm always interested in seeing if what I'm talking about is resonating with your experience as well, or not.
Yeah. So we just got a question in the chat box, and Kate, there are 44 attendees.
Okay, thank you for that.
So Tanya asked, have you / your practice seen any social changes around parenthood pressure during the COVID-19 period?
Yeah, I guess I'm curious, Tanya, could you tell me more about what you mean by social pressures? I know that my answer is yes, but I want to be more specific to your question in general.
Tanya, and I'm going to unmute you so you can ask the question instead of typing if you'd like.
Thank you. Yes. Hi, thanks for having us. I'm wondering, given that you've mentioned that all of us are feeling a lot of this anxiety and worry and struggling, isolation, if you've noticed any on the social pressure side from people around new parents or other parents, right? Any relaxing around pressures, because that's been something that parents that I work with struggle with and especially before, I haven't really been able to assess too much lately. So, just being the perfect parent and the perfect new mom and bouncing back and all of these pieces. Thank you.
It's such a good question, Tanya. I'm so glad you're bringing that up. I think similar to what we've been saying, it's a real both and, right? So in our practice, right? So we are a maternal and early family mental health clinic here. And so the folks who come into our office are usually the parents who are struggling the most, right? We find in postpartum that we're trying to change this through talks like this and prevention, but we find that people often don't come to us until they're really struggling, right? So by the time people come in our office, they're already struggling with pretty significant symptoms of depression or anxiety. I think the pressure to keep children safe has really been exacerbated during this pandemic. So what it means to be a good mom during a pandemic might look like how safe are you keeping your kid? What it means to be a good mom or parent, I should say, of course, pre-pandemic often has to do with how much you getting your kid out, right? How much social interaction are you providing for your kid? And so what it looks like to be a good parent has shifted quite a bit. I know really we're kind of looking at this perinatal period right now, but another thing that we've seen is this pressure to provide schooling at home during this pandemic. And so now suddenly what it means to be a good parent of a child who's school age is that you are also that parent, that child's teacher or facilitator of online schooling. So I would say that the social pressures have changed quite a bit. I think the problem with that is as parents are led to believe that it is most socially responsible, good parenting to keep your kid isolated, that parents' depression and anxiety has increased dramatically. So what I've said often to the parents in my practice is we have to look at health, at family health from that biological, psychological, and social perspective. And if we're just looking at biological health, we're missing the impact of social health and psychological health. I have some parents in my practice who literally have not left their home in 2 years with small children. And these are the more severe cases of parental anxiety and depression. But of course, when a parent stays at home and their kids stay at home, we're now putting both parents and kids at risk for all kinds of social stress and psychological stress. And when we have more stress, our immune system drops, and then we're more likely to contract viruses and illness and disease. And so I love the question because I think there is so much high pressure to be a good parent. And yes, I think it's changed quite a bit. And I think that social isolation, which has sort of suddenly become part of good parenting, is causing illness for lots of families. So Tanya, I hope that answers your question. I'm happy to go into more specific detail if you need anything else.
Great. We also have a comment from Susan, if you're willing to take that as well, Kate.
Sure, no problem.
Okay, I'm going to unmute Susan. Susan, you have the floor. You can also, if you don't have access, you wrote something in the chat that I can read out loud as well.
I'm sorry. Can you hear me now?
Yep,
Yeah.
I can hear you now.
All right. I think pushing the unmute is very helpful. All right. This is Susan Geisler. I
Hi, Susan.
am a teacher and a doula at Rose Medical Center.
Mm.
And what I have to say completely dovetails with Kate, your very insightful knowledge about wanting to be a good parent. So what I notice is a really big pressure is students who hear from each other, and usually it's such a good thing to hear a variety of different ways, but on personal protocols related to the postpartum household. There's very little information that is reliable and consistent across OB, pediatrics, the workplace. And so parents are struggling to know what is the right thing to do. Should I have my parents come in and visit? Should my mother come and stay with us? What if she's coming from Florida? And the guidance on that is not clear, and it's only spontaneous. It's not built into the system. And I think parents sometimes need a chart that says, here's what you need to do week 1 or week 3 regarding exposures. This is what you need to think of. And there's just a lot of pressure that fits into that milieu of wanting to be a good parent.
Susan, thank you. I'm just so appreciative of that insight. And I think you're right. I think what makes this really tricky is that there's no right answer. And new parents, most new parents are searching for the right answers, because I've yet to meet a new parent who doesn't want to be a good parent, right? That I've yet to meet that person. And so often those new parents, especially first-time parents especially, are looking for the advice from outside to tell them what to do. And there is no right answer. And that is very hard and very confusing for many, many folks. I think, I'm not a doctor, and I'm certainly not in the business to ever tell a new family what they should or shouldn't do, but I often find it really useful to do that education piece on the biopsychosocial piece of health. That's sort of a term that we use often, and we help families to understand what that means, but that we really, our overall health and wellness requires attention to all 3 of those areas. And if we're not, as I said in the beginning of this talk, if we're not filling the gaps in all of those areas, we are going to struggle psychologically, emotionally, or physically. And so really doing some hand holding and helping folks understand that this is sometimes can feel like an impossible decision to make, but there's no right answer and there's no wrong answer. And when I'm able to hold folks through that process, I do see some of the nervous system, kind of the heightened fight, flight, or freeze place, which of course makes it impossible to make decisions when we're in that place, right? I do see some of that settle a little bit, but Susan, I really appreciate your comments.
Thank you. And just one other note is that it's not only pressure from peers, excuse me, but within couples.
Yes.
And so the one spouse wants this, the other spouse wants that, and it causes a lot of friction.
That's right. That's right. And again, what you're saying is the perfect sort of definition or example of what we talked in the beginning about how being at home, right, during this pandemic has increased the stress and strain in relationships pretty exponentially. Thank you, Susan, so much.
Thank you so much.
Yeah.
Kate, no more questions at this time, but I will let you know if we do, okay?
Sounds great. Feel free to interrupt me if they come up. Okay, let me catch up. So we certainly want to talk a little bit about how we can help. And I'm getting the sense that there are, that Susan just sort of reminded me that you all are coming from many different backgrounds, professional backgrounds, certainly personal backgrounds, but also milieus of where you work. And so I really want to encourage all of you to translate what I say in the next few slides to fit into the place of your business and work and how you interact with that new families. I think we want to, I really cannot say this enough. I think we want to be thinking about our role in prevention. Right? We don't want to wait till we have families who are struggling postpartum with mental health challenges. And I kind of skipped over this a little bit in the beginning, but undertreated or untreated parental mental illness is the leading cause of social, emotional, psychological, and developmental delays and challenges in children. So we really want to make sure that our parents are getting what they need to be well enough to parent their children the way they want to, of course, and the way their children need them to. So providing that education early is super important. We're going to go through each of these in a little more detail as I go through the slides. We're going to talk about screening. Screening is really can be done by anybody. Screening is not necessarily diagnostic. And so really knowing that what screens you use in your place of business and how to use them well is helpful. We're going to talk a little bit about some important and hard questions to ask. I think the screens, we know through the data tells us that screens themselves don't do enough. Lots of people know how to fill out the screens so they can move through without having to acknowledge those vulnerabilities. And we really want to be asking those direct questions. And we want to know what is around us. What does it look like when we have access to a family who's struggling? How do we refer appropriately? I'm going to tap into a little bit about our perinatal assessment program here at the PwC, and happy to answer more questions about that as well. Elena, I just want to see how much time I have. Do I have the full hour, or what time do you want me done by today?
You could just finish by 12:55, just so that we have enough time to finish that post. Other than that, you'll be good.
That's great. Thank you. Okay. So as far as providing education goes, we really want to make sure that we are giving our families that general information on perinatal mood and anxiety disorders, and really helping families understand this is the most common complication of childbirth, right? It's often the least talked about, but it's the most common. And I think universally, we have our families come into these offices or join our webinars or any online groups that we have, and they feel like they're the only one that's struggling in this way. And we want to make sure, we want to normalize both that new parenthood is hard, right? We sort of are told often it's going to be the happiest time of our life. And that expectation in itself can set us up to develop symptoms of depression or anxiety, because we know, as wonderful as this is, it's really complicated and really hard. And wanting to make sure that families understand that this is not because they're bad parents. This is because there's an interplay between brain chemistry and external stress. And sometimes that can create a perfect storm for developing symptoms of depression or anxiety. As I mentioned earlier, one of the best prevention pieces to discuss is that biological, psychological, and social health, really tending to our brain and bodies. Biologically, physical health, really meaning that our brains and bodies, how are we taking good care of our brains and bodies through nutrition and breath and hydration and medical care if necessary, and exercise or movement, all of those things. Our psychological health looks at our beliefs and our thoughts and our feelings. And we all know that we carry all kinds of beliefs into new parenthood. So really getting enough support around that to make sure that we're set up for success. And our social health. And I'll say it over and over again, isolation is a kind of recipe for developing depression and anxiety postpartum. Early signs and symptoms so that our parents can get in quickly. Really, one important kind of attachment piece of data to know is that parents and their children, or care provider, primary care provider, care providers in general, and their babies' nervous systems are directly connected until that kiddo is about age 3. At around age 3, a baby or child's brain has developed enough capacity to self-soothe. But up to that point, babies and children are borrowing from their parents' nervous systems. And so it's really important that we get those parents in early for support so that they can support their children's development of healthy nervous systems as well. And of course, direct information. So once we give our families all of that information they need, we want to tell them where they can go for support. There are three universal screening tools that I think are most widely used for assessing PMADS. The EPDS is the only universal screening tool for postpartum depression. This is available in, I think, almost every language translation. Families can download it online. Really important to know that this can assess quite well for depression, but is not great at assessing anxiety. So we can have parents who are struggling with a pretty severe anxiety disorder and receive a pretty low screen on the EPDS. A screen of 10 or above on the EPDS suggests that that parent might be struggling with more clinical degrees of depression or anxiety, and so really want to get that person into care if that's the case. Our PHQ-9 is really the most widely used assessment for depression outside of the perinatal period, and the GAD-7 is a great tool for screening for anxiety. So I would really encourage, if your practices are not already using these and you're not using these with your patients and families already, to have them at hand, and then to be able to talk to them about those screens. So sometimes what can happen is you can give your postpartum family member a screen and get a little nervous about how to actually ask the hard questions. We find this all the time. It sort of feels like we're doing something by providing the screen, but we don't necessarily want to get into it with some families because we don't know how we would respond. These are some really important questions to learn how to ask directly. Are you having any thoughts that are scary to you? This question is going to get at belief systems that a parent has that puts them at risk for depression or anxiety, like, I'm not going to be a good mom. I don't know how to do this. I feel like I'm failing. Those are all beliefs and thoughts in new parenthood that will pretty quickly lead towards depression or anxiety if not worked with for quickly. We will also have parents, ideally, who are struggling with postpartum obsessive compulsive disorder. I did not go into this in the beginning, but postpartum OCD is one form of an anxiety disorder postpartum. And what it looks like is a parent who's having very scary, very intrusive thoughts of harm coming to their babies. Often in these experiences, it's the parent who imagines themselves causing the harm. Really important to recognize this as being very different than psychosis. So a psychotic fear, a thought or fear that someone's having when they're in a psychotic state won't necessarily feel odd or wrong to that parent. An OCD thought that's very scary for the parent, thought of throwing a baby down the stairs, thought of drowning a baby in the bathtub. These are pretty frequent fears that a parent might have if they have OCD. These thoughts create immense amount of anxiety and fear for that parent. And that parent will do everything they possibly can to make sure those things don't happen. But this will be a time that you will be able to assess if a parent is having scary thoughts if you ask directly. And I will say, OCD is very treatable in therapy and often with medicine if the severity warrants it. But if a parent doesn't get a support and treatment, it can cause all kinds of ripple effects, such as challenges with attachment and oftentimes we can lean towards suicidality for parents who have these thoughts because they can be so scared that they might actually act out on these thoughts. So we want to make sure the parents with OCD get treatment really quickly. Number 3, are you having do you feel safe at home? This is a really important question. I think one of the things that's happened during this COVID pandemic is that domestic abuse has increased. And, there's sort of this deep kind of barrier between people's existence inside of a home and what people outside are having access to. And I cannot, in all of our perinatal assessments that we do, which I'll talk about in a moment, we're asking this question. This is a hugely important question to be asking all of our new families. And are you having thoughts of hurting yourself or your baby? Again, this can kind of move into the more severe forms of depression or anxiety. We want to make sure that those families are getting the attention that they need. And because there's so much isolation, it's really easy for someone to not acknowledge this in just an assessment. And so we need to be having those conversations. One piece of advice I have to everyone on this call is that you make these questions just standard care. You ask every family and parent these questions, regardless of how well they're doing or regardless of whether or not they're at risk. This just kind of becomes a universal conversation to have. I will also say, I think, I am bias in this, which I think probably goes without saying, that some of these symptoms can be so subtle, and learning how to ask these questions where we open up space for people to feel able to be vulnerable takes a fair amount of skill. And so if you or your organization doesn't already have some formal PMAD training, I would really encourage you to do that. Let me pause for a moment. I'm going to go back to the slide and just see if there are any questions up to this point about education and assessment.
Not seeing any in the chat.
Okay.
So why don't we keep going? And if anything pops up, I will let you know.
Feel free to interrupt. That sounds great. Postpartum Support International is the largest web-based support network around the world for families struggling postpartum. And if you go on to postpartum.net and click on the Get Support button, you will find coordinators in each state, and often in many communities in those states, who will know who the practicing providers who are trained in PMADS are in that area. And so I really encourage you to have some sort of just general place where you refer your folks to this organization. It is an incredible organization. They have all kinds of information on different types of perinatal mood and anxiety disorders. They offer free online chats and free phone calls and free information for providers. It's an excellent resource. And I think it's quite typical that folks may not know who is available right in your community. And again, there will be someone through PSI who will know exactly who those people are. This is a really incredible resource. I would also just encourage you, certainly if you're in the Boulder, Denver area, the Postpartum Wellness Center is here. I'm happy to answer more questions about our organization specifically if you have them. But we are always happy to provide you with what we know are resources in the Boulder, Denver area as well, if you have them and you're in this more direct community. Without having to say it, we know that collaborative care is really the way to go here. And there really is no way to support a family during pregnancy and postpartum without leaning on many other providers who do this work. And I think when we work in isolation and don't work collaboratively, we will have families fall through the cracks. So we really want to make sure that we all know who's out there and that we're all working together. I'm going to just very, very briefly in the next maybe 2 minutes describe to you what our perinatal assessment program is here, because we have had just an exceptional amount of positive feedback about this, both through the medical clinics we work with and the families who we see. Our perinatal assessment program was formed to meet two needs so that we could train. We do a lot of training here. We're a training organization for counselors and therapists who want to go into the field of perinatal mental health. So we wanted to have a really good training option for our folks. We also wanted to make sure that more families, if not all families in our community, were having these really thorough assessments, and so that we could assess early and refer for treatment. So we place our graduate students in OB-GYN and midwife clinics to do online, virtual, free 30-minute mental wellness assessments, essentially, for all patients in the OB and midwife practices that we are that we collaborate with. Those assessments involve getting lots of demographic information. We're wanting to make sure that we're keeping really good tabs on all of the variety of families who we see, so we can make sure that we're addressing the gaps in care when they show up. We provide formal measures in our assessment. Both the GAD and EPDS is something that every parent gets, and then we assess those and talk about those scores. We also have a biopsychosocial questionnaire. So that's going back to those 3 areas that I told you that we want to be assessing really carefully with our families to make sure that we know where the challenges are for each parent, and also where we can begin to offer that support. And we have that therapist interview. So our therapist, our graduate clinical therapist, will go through this information with every new parent. Some of our organizations, we do this pregnancy, all of them we do 4 weeks postpartum, but it takes about 30 minutes. And within that 30-minute time, we can have a pretty good sense of how these parents are doing. We will have a follow-up for parents who are doing well. In 4 weeks postpartum, our graduate students will follow up with a call to check in. All of our new parents will get a packet of information sent to them on warning signs and resources in the community, and where to reach out for help. And those folks who are struggling at the time of the interview will receive a warm handoff, will directly be connected with a mental health provider. Sometimes they'll also be connected with a lactation consultant or a sleep specialist or someone else as well. So our assessment, I'm not going to talk about all of this. You can look at this later in the slides, but these are sort of the risk factors that we address in our assessment and in our interview. And our screening involves these things. And of course, I'm hopeful that you all are able to do this as well. We, as a summary, want to normalize all these parenting challenges, especially during COVID. We really want to make sure that our families whose symptoms are being masked know to look for them and know that they might be beyond what we would normally expect during this pandemic, especially as we move out of some of the tighter constraints of this pandemic. We want to make sure that moms know, parents know how frequent families will experience these struggles. Definitely want to make sure those perinatal folks know that it's okay to not feel okay, right? Our culture will often set us up to feel like we're supposed to feel good all the time, and that is just not realistic for new parents. We want to ask those hard questions, provide resources, and bring in those supports when possible. So partners, family members, other providers that you might be collaborating with, we really want to, as much as possible, surround our families with the kind of care that they need, both so that people can pay attention and step in with support when needed, but also so that those families know that they're being cared for and that there's support available to them. PwC, just a side note, offers these supports as well. We do provide training for organizations who want their staff to be trained in perinatal mental health. We provide reflective supervision to clinicians and also medical practices. We want to make sure you all have the support you need. Working with this demographic can be really, really overwhelming, and we want to make sure that each provider has support that they need as well. And this is an awesome little slide here. I'm hopeful you can read it, but this of course is what we see all the time, right? Partner says, or co-parent says, do you need anything? And postpartum parent says, nope. And then of course there is a long list of things in that parent's head that she needs and wants and desires and doesn't know how to ask for it. So we're really hopeful that through talks like this and through all of us working together, we can create that opening for our parents to ask for what they need and receive that support. I am going to be quiet for a few minutes and see if anyone has any, I have some references here too, if anybody wants to learn more about anything we talked about, but open up for questions if there are any, or comments.
And I just popped Kate's email in the chat. If you have any further questions for her. And Katie is going to share her screen really quickly, just so we can pull up the continuing education credits. But thank you so much, Kate, for this phenomenal presentation. We want to thank you again for stepping up last minute and presenting due to a last minute cancellation. We're so grateful for your wealth of knowledge you shared. And so This QR code is for the continuing education credits for people who are registered nurses, and I will also pop into the chat the link for it as well. And I'm now going to pull up our final poll that we would love for you to complete prior to leaving. This web series is grant funded. It is important for us to evaluate the effectiveness of our work. Your input also allows us to make adjustments for future webinars as needed. Thank you again for everyone attending, and we hope to see you at the next webinar on April 25th.
Okay, I see one question there. Can I answer a question?
Yeah, of course, yeah.
I just lost it. I see a question, how impactful is lack of sleep in PMADS? And Susan asked that question, and I think probably most of us can attest, even our own lives, that lack of sleep can be a kind of deeply quick risk factor to depression and anxiety. And lack of sleep is one of the things that we address really quickly for those perinatal parents. And those folks who are anxious are often going to be up at night having a hard time sleeping. So sleep is always one of the first things that we're going to treat. And there are, depending on the different types of struggle or severity of struggle, different kinds of treatment options, right? We have a psychiatric nurse practitioner here who does medication evaluations for folks who need to go that route. We know that there is a lot of cognitive behavioral therapy for sleep, for insomnia practices that are really helpful. What we find, and this is sort of just a quick, I'm going to open up a can of worms that I'm not going to be able to finish, right? But sleep, when we go to sleep, being one of the most vulnerable times in our lives, right? As animals, of which we all are, our brains will keep us awake unless we feel fully safe enough to go to sleep. And when you add a baby into the picture, and it's our job to keep our baby alive, if there's any part of us that does not believe that our baby will be safe while we're sleeping, we will not sleep. So there's lots of kind of tips and tools and strategies and therapy that can help ease that piece too. But I love that question because lack of sleep is often directly related to anxiety and other mental health challenges.
Definitely. Thank you for
All
answering
right.
that, Kate.
Yeah.
Carla, just to answer your quick question, not at this time. We just found out that we could get these continuing educations for nurses right before this presentation, but we will look into that in the future. If there's a specific type of certificate for completion that you're looking for, I'm happy to address that. If you could just email us, our email is info@cpcqc.org.
So typing in here, our website, we often, or from time to time, do present more in-depth training on perinatal mood and anxiety disorders through virtual options or opportunities to the Postpartum Wellness Center. So feel free to check on our website and see if there's anything that anybody on this call finds useful as well. Thank you so much for having me. And if anyone has questions and you don't have a chance to chat, type them in here, feel free to email me. I'm happy to get them your way. And again, just so honored to be here. So thank you.
Thank you so, so much, Kate. We really appreciate you being here today.
Absolutely. Anything else from me?
No, I think we're good. I know you have a client to rush off to. So
I'm gonna jump
thank
off.
you so much. Yeah.
Thank you, everybody. Yeah.
And thank you all for joining.
We have something in the chat. Samantha said that the eval doesn't seem to be working. Is it working for others?
Samantha, is that the continuing education eval? Is that what you mean?
For the Zoom poll. Okay, yeah, she said the link. So the CE.
Okay, let me quickly see here. Oh, it looks like it's reached the scan limit. Hold on. Try this one.
And we